Okay, let's dive right into this explainer. Today, we're jumping into the high-stakes, incredibly fast-paced world of sterile processing. You already know this is the heartbeat of hospital safety, but we're going to unpack the hidden, yet absolutely critical mistakes that newer technicians often make during that crucial first year on the job. We aren't just talking about cleaning here. It's about mastering those protocols that literally save lives. So let's get right to it. We're going to follow the life cycle of a medical instrument through 5 logical phases, starting with the high stakes, then decon dangers, assembly pitfalls, the paper trail, and wrapping up with success strategies. First up, the high stakes of sterilization. You know, a sterile processing department technician isn't just a cleaner, not even close. You guys are literally a critical line of defense. So what actually happens when the sterilization process is rushed? Well, when a new tech loses focus on the details or, tries to beat the clock, it disastrously compromises patient safety. In our field, a misstep isn't just a typo, it's a potential infection. We're talking about the stark difference between a perfectly successful surgery and a life-threatening complication. To truly grasp how vital this role is, we really need to track the actual physical journey of a contaminated medical instrument through the 3 core stages of the workflow: decontamination, assembly and processing, and documentation. Dropping the ball at literally any of these gateways, it completely breaks the entire chain of safety. Moving on to Section 2, danger in decontamination. Now, this first stage builds the absolute foundation of a safe surgical environment. Because let's face it, if an item isn't perfectly clean, it just cannot be sterilized. A massive, massive early career mistake is missing the bioburden. That's the invisible army of microorganisms contaminating an object before sterilization. And guess what? Bioburden loves to hide. It tucks itself away inside the delicate, really hard-to-reach parts of instruments. New techs might also fail to properly use the automated cleaning equipment. And if you leave even a speck of bioburden behind, the sterilizer simply cannot do its job. The microorganisms are essentially wearing a shield. But hey, the danger in decontamination isn't just about the patient. Actually, it's very much about the technician too. Failing to wear appropriate PPE, like masks and face shields, presents a major physical risk to you. Sometimes new techs skip wearing a mask or a face shield just because it feels kind of cumbersome or annoying. But doing that exposes you directly to hazardous biological material. Bottom line, you absolutely cannot protect the patient if you aren't protecting yourself first. Okay, Section 3, assembly and loading pitfalls. Once those instruments are perfectly clean, they've got to be put back together. And this is exactly where a simple, everyday urge to hurry can lead to a massive cascade of mechanical failures. When techs rush the assembly phase, they make some absolutely critical handling errors. They might lose track of missing parts or pack totally incorrect instruments into a set. They might carelessly crush super fragile tools under heavy retractors or kink vital cords. Or, and this one is crazy, they might totally forget to check if the instrument actually works. Just imagine a surgeon reaching for a tool right in the middle of a procedure, only to find out it's missing a piece or just flat out doesn't function. That entire nightmare stems directly from rushing the assembly and inspection phase. And you know what? Those pitfalls? They continue right into the sterilizer itself. Misloading equipment is a huge, huge issue for newcomers. We're talking about overloading washers and sterilizers, or choosing completely incorrect sterilization cycles for the materials they're handling. Even placement errors are critical here. For instance, placing paper or plastic peel pouches incorrectly, like slapping plastic directly against plastic, can physically block the sterilant from penetrating. Or what about dropping count sheets inside sealed trays? Again, that can literally interfere with the whole sterilization process working the way it's supposed to. Every single item has to be placed with absolute geometric precision. No exceptions. Which brings us to Section 4, the paper trail. Shifting gears from physical handling over to administrative duties, a massive pitfall for newer techs is completely ignoring the IFU, the instructions for use provided by the manufacturer. Tons of first-year techs make this really dangerous assumption that all instruments follow the exact same generic rules for cleaning and sterilization. Let me be clear, they absolutely do not. Complex medical devices have highly, highly specific manufacturer's standards. If you ignore the IFU, well, you're just guessing. And guessing has absolutely no place in a sterile processing department. And it's not just about reading those instructions either. It's about writing down your own results. Tracking everything is 100% mandatory. Neglecting these tracking records, like failing to log sterilization records or, forgetting to document the daily temperature and humidity levels in the processing areas, that instantly compromises the integrity of the entire sterile processing loop. Here's the golden rule of documentation. If you didn't document it, in the eyes of an audit or a safety review, it straight up did not happen. All right, our final stop, Section 5, Strategies for Success. So, how do new technicians actually shift their mindset to actively avoid all these devastating errors? Well, it really comes down to the ultimate daily choice. On one hand, you have focusing on speed. On the other, focusing on accuracy. Rushing is, without a doubt, the fastest way to make a critical error. Why? Because a fast, incorrect tray has to be totally reprocessed from scratch, which ends up wasting far more time than just doing it right the very first time. At the end of the day, accuracy is the only metric that truly matters. To hit that level of accuracy, you've got to use your resources. Never, ever be afraid to ask for help or ask questions if you don't recognize an instrument or a specific procedure. The absolute best technicians out there, they aren't the ones who just try to memorize everything. Nope. They are the ones who always lean heavily on their department's standard operating procedures and the manufacturer's instructions for use. Honestly, using your SOPs and IFUs is the true hallmark of a seasoned professional. Listen, if you only take away one single piece of advice from this entire explainer, let it be this master mindset. It's the golden rule of the SPD. Treat every instrument as if it were to be used on your own family member. Seriously, when you look at a tray of surgical tools, don't just see a pile of metal and plastic. See the patient. See your mother, your brother, your own child. That perspective, it completely changes how you handle every single item. I'll leave you with this one provocative thought to really chew on the next time you step into that decontamination room or load up a sterilizer. Is your standard of care high enough to protect the people you love the most? Let that question drive your focus, your accuracy, and your total commitment to the clean. Thanks for joining me on this explainer, and keep asking the right questions.